I was at home with my wife. It's about 10:30 in the evening, and we started making out. And at some point, my wife noticed that I was a little bit distant. And at the same time, I was feeling a little woozy. So my wife asked me to sit down, and she realized I was having what she termed as a right side CVA. When she sat me down, my right arm was limp, and I couldn't speak. She immediately called 911, and about 10 minutes later, the paramedics showed up. To their credit, they immediately put me on a board, put me in the back of the EMS vehicle, took me straight to Willis Knighton. Little did I know that they had been trained by personnel at Willis Knighton for stroke recovery. At that point, paramedics took me straight to imaging, and little did I know that they had already set it up that I would go straight to imaging, bypassing the emergency room. When the doctors told me I was having a stroke, I was absolutely terrified, because at that point I was lying on the table, could not move my right arm or my right leg, and I couldn't speak. They reassured me that everything's going to be okay. They actually administered a drip within 45 minutes of the onset of the stroke. As a result of that, they expected a almost complete recovery, if not a complete recovery.
If we don't give reperfusion therapy, if we don't give the TPA, it's very likely that what the patient has, what you had to begin with, would have stayed with you. You would have had that deficit for quite some time, and then until you naturally improved. But the stroke would have been much, much larger, and your symptoms would have been much worse.
After the clot-busting drug was administered, within about 2 hours, I noticed that sensation in my arm was coming back, my right leg was coming back, and I was able to utter a few sounds. And then a couple hours later, I was able to actually get up and walk.
Some of this brain tissue dies in 5 or 6 minutes, but it's that core that produced all of the rest of the symptoms of that you had very initially, that then got better over the course of a day or so.
The stay at the hospital was absolutely amazing. Starting with the emergency room, I was attended to by at least 4 or 5 different nurses and doctors. Then they brought me to the ICU, where around the clock, every 15 minutes, I was being checked on. Then I was moved to the stroke unit, and there I got extremely good care.
Erica. How are you? You doing good?
I'm doing great.
Well, you look amazing.
Well, thanks to your awesome care. My nurses, Erica and Hannah, were awesome, attending to every one of my needs. And I often thought, what if I wasn't brought to Willis Knighton in time? What if I didn't have the TPA? And I'm realizing my life would be totally different. Number one, I might not be here. And if I had survived, I'd probably be severely disabled. If you ever find yourself having stroke symptoms and you have an option, I would choose Willis Knighton Piermont. I should know they restored my life.